Hello, everyone. Welcome to today's session. We're so glad you could join us. While folks get logged in, I do have a couple of upcoming announcements. On Tuesday, May 13th, we're going to be having another presentation also on the PULSE study, looking at a different aspect of the study. That presentation will be on the impact of line speed on worker exposure to parasitic acid in poultry and swine processing. That will be with Jenny Leigh Holroyd, Dr. PH and CIH. On Tuesday, May 20th, we're going to have an industrial hygiene presentation on Beyond the Call, Industrial Hygiene Strategies to Protect Emergency Responders. That will be with William A. Jetter, PhD, in the University of Cincinnati Education and Research Center. Our next ergonomics themed webinar will be on Wednesday, May 21st, and that will be on bilateral assistance from active knee exoskeletons, reduce the difficulty of occupational lifting and lowering tasks with Grace Hunt, PhD, in the Rocky Mountain Center for Occupational and Environmental Health. For more, you can visit us online at coeh.berkeley.edu/webinars. And on behalf of education and research centers throughout the country, we're pleased to present the ergonomics, ergonomics webinar series. This is a collaborative effort on behalf of each ERC's continuing education program and is set by us to provide you all access to current research supported through NIOSH ERC programs. We're going to have a little bit of a NIOSH announcement towards the end of today. We're going to go ahead and continue forward with the presentation. Thank you for being here today and showing your support. We really, really appreciate you all joining and showing up for our workers and doing everything that we can to help keep people safe and healthy. Today's webinar, Poultry Processing and Worker Health, Results from the PULSE Study, is presented by Carisa Harris, PhD, CPE. She is the director of the Northern California Education Research Center and also the UC Ergonomics Graduate Training Program. A few housekeeping announcements before we get started. You are going to be muted during today's presentation. If you'd like to ask a question, please enter it into the online Q&A, and we'll save time at the end of the presentation to address as many questions as possible. We're also going to have the chat open, so feel free to use it to participate, say hello, and join in on the conversation. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page within 5 business days. And all participants who logged in today with their registration email for the full live presentation will receive an email tomorrow with a link to an evaluation form that will qualify you for a certificate of completion with 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. Without further ado, it is my absolute pleasure to welcome our presenter today, Dr. Carisa Harris. Dr. Harris is an assistant professor in the Department of Medicine at the University of California, San Francisco, and in the School of Public Health at UC Berkeley. She's also the director of the UCSF, UC Berkeley Ergonomics Research and Graduate Training Program, and director of the Northern California Center for Occupational and Environmental Health. She received her PhD in Environmental Health Sciences at UC Berkeley and teaches classes including Occupational Biomechanics and Industrial Engineering Human Factors Design. Dr. Harris and her team perform research in a variety of areas focused on understanding and preventing work-related injuries and improving human performance, productivity, and health. Her team is also developing a variety of exposure assessment devices and wearables for primary and secondary prevention purposes and performs various intervention studies on occupational tasks with high risk of musculoskeletal injuries. The lab has a long history of performing research in construction, computer, medical, hotel, and manufacturing sectors. Thank you so much for joining us today, Dr. Harris. I'm looking forward to your presentation.
Thanks so much, Michelle, and thank you for all you and your team do to bring us this webinar series. I'm really delighted to be here today. As Michelle mentioned, I'm a professor at University of California, San Francisco, as well as at UC Berkeley. And this project couldn't have happened without a lot of people at both universities. And so I just want to take a moment to thank them, as well as a couple of partners at other universities like University of Iowa and Georgia Tech. So today I'm going to be speaking about the poultry processing project. This was a really interesting project that actually brought about a lot of different areas of research that our lab has been involved with for a long time. And I'm going to talk a little bit about the history and the background about why this project even was started and implemented. I'm going to talk a little bit about the prevalence of exposure to high levels of ergonomic hazard, the prevalence of moderate to severe upper extremity pain among poultry processing workers. And then we're going to look at the effect of evisceration line speed and something called piece rate on ergonomic hazard. Piece rate here has a slightly different definition than what you might think of as far as piece rate as a pay structure. And so I'm going to go over that definition a couple of times during this presentation. And then we'll talk about how detailed ergonomic assessments can be used to identify acceptable workloads and really kind of identify how the process and methodology that we used can be used in other industries as well. So a little bit of background, as many of us know, repetitive exertions, forceful exertions, and non-neutral postures have been identified as risk factors for musculoskeletal pain and musculoskeletal disorders. These risk factors and high rates of injuries have been identified in poultry processing plants for decades. There have been many studies over the past decades that have identified these various hazards, as well as high rates of injuries. One of the most recent ones was done by NIOSH through their health hazard evaluation group, where they documented a high prevalence of carpal tunnel syndrome and symptoms that were related to ergonomic hazards. The way that they measured those ergonomic hazards were slightly different than what we did in this project, but it is a really great report and recommend reading that if you're more interested in what they found. This study also used tools, risk assessment tools that have been validated in many prospective epidemiological studies. And so we chose these tools like the ACGIH TLV for hand activity because they provide a valid and quantitative estimate of ergonomic hazard that are known to be predictive of MSD risk. So background on why this study was performed. From October 2018 to April 2020, the U.S. Department of Agriculture Food Safety and Inspection Service, called FSIS, granted 53 evisceration line speed waivers to poultry establishments that allowed qualifying new poultry inspection system establishments to operate at evisceration line speeds up to 175 birds per minute. Now, previously, they were required to operate at a maximum of 140 birds per minute. And so there was a lot of debate as to whether this was coming at the expense of workers, meaning did this increase in waivers and this increase in evisceration line speed come at an increased hazard and risk of pain and injury to poultry processing workers. And so this was challenged by labor organization group, and eventually the response was for the USDA to put together a study that would evaluate the association between evisceration line speed and ergonomic hazard. And so the aim was for us to quantify the association between evisceration line speed and ergonomic hazard in U.S. poultry processing plants, primarily in those that were operating between 140 and 175 birds per minute. We also looked at piece rate, something that could also be thought of as task rate or the piece rate pace. This was because we realized in visiting these different plants that the workload was really going to be dependent on how many people were staffed at these different positions, as well as the different line speed that was occurring in different parts of the plant. And so to talk about that a little bit more, I'll walk you through kind of a general process on how a chicken is processed. Chickens come in, and there is a place called live hang where live chickens are hung up on shackles. They move to a point where machine will eviscerate them. And so that is the evisceration line speed. So this point here is where we measure the 140 to 175 birds per minute. After the birds get defeathered and eviscerated, they go into a cooler. They come out of the cooler and they go to a place called chiller rehang, where the carcasses get rehung on shackles. And then they get processed either by getting separated, where the bottom half goes in one workflow, and the upper half might go to another workflow, like a cone line. There could be some hand trimming after the cone line, and eventually these different parts that have been disassembled from the bird go into a packaging area and then eventually packaged and palletized. What's interesting is that there can be different speeds at different parts of this process. And so again, when we talk about evisceration line speed, I'm talking about the speed that the birds are actually getting eviscerated. And this is a really highly mechanized process, meaning there aren't really humans involved in this part of the process, but there are a lot of humans involved in live hang, in chiller rehang, and downstream. So in this study, what was unique about it is that we went to 11 establishments. We were going to go to 12, but one dropped out at the last minute. These establishments all worked between 140 birds per minute and 175 birds per minute as far as their evisceration line speed. We had 4 establishments in a category operating at less than 145 birds per minute. We had 3 establishments that worked between 145 and 175 birds per minute, and then 4 establishments that operated at 175 birds per minute. You can see that the average and standard deviation of bird weight, meaning the size of the birds that were processed in these different plants, varied. They roughly were between 7.5 and 9 pounds. And then you can see that the average evisceration line speed was between 142, 162, and then 175 at the 3 groups of evisceration line speeds. So as I mentioned, although the debate is really around this speed here, because that is what the USDA actually has any sort of control or regulation over, the line speed at live hang can be very different than this evisceration line speed. And the line speed downstream, say at chiller rehang or even the cone line, is different as well. So if, for example, at live hang, we measured speeds between 139 to 193 birds per minute. And because there are different numbers of people staffed doing that job, the piece rate, meaning the number of birds handled by each person, is somewhere between 15 and 39 birds per minute. After the evisceration line speed point, we measured line speeds between 71 and 173 birds per minute. And again, based on the number of staff, the actual number of birds handled per person ranged between 18 and 50. And then from the chiller rehang, the birds are separated into multiple lines. And so the cone lines might be operating at a speed of, say, 35 to 38 birds per minute. If we wanted to define worker piece rate and job line speed and evisceration line speed in a little bit more precisely, I can use live hang and chiller rehang as 2 jobs that I'll give an example of. So again, if the evisceration line speed is, say, 175 birds per minute, and that is a very highly mechanized point, we might count or quantify the job line speed as the number of shackles that pass by a fixed point per minute for both live hang and chiller rehang. And then we might quantify the number of staff that hung the birds onto those same shackle lines at the moment we were taking exposure assessments. And then we also could quantify the number of birds hung on shackles by one worker or each worker per minute, and that would be by video tape of the workers that we evaluated. And so again, here piece rate is just essentially the number of birds hung per minute on shackles. Now, as I mentioned, the 2 independent variables are evisceration line speed and this measure of piece rate. Our dependent variable for this study, or the primary dependent variable, and the one that I'm going to go over today, is the ACGIH TLV for hand activity. This is a hazard assessment tool that identifies or utilizes normalized peak force as well as hand activity level. You can see that this solid line indicates the TLV, or the threshold limit value, and anything in this red area indicates a peak force index threshold limit value score of more than 1, and would be interpreted as increasing musculoskeletal disorder risk. As I mentioned, there have been multi-country prospective epi studies that have validated this tool, and so this was one of the reasons why we chose it. Another reason is that we could use the video to quantify very precisely a hand activity level score, and we could use EMG to quantify this normalized peak force, the two components that derive this PFI TLV score. In this cross-sectional study, we included a survey and medical interview. The survey collected information on demographics, work history, and organization, such as how long they've been working at the company, how long they've been working in that type of job. We also asked about their pain and discomfort on a 0 to 10 numeric pain scale. We asked about pain or discomfort that lasted more than 1 day during the prior 12 months. And then we asked them about various reporting practices and injuries that they had experienced. We also asked employees about their perceptions on line speed, and something called a break-in period, meaning how long did it take them to get used to their job when they first started before any pain that they were experiencing resolved. Now, to quantify the normalized peak force, that is, again, one of the components of the ACGIH TLV for hand activity, we used an 8-channel surface electromyography forearm cuff. As you'll see in the next slide, this cuff has 8 channels, and really it gives us a measurement of how much global forearm muscle activity there is. You can see in this example here that, let's see here. We have someone in our lab who's simulating cutting, and you can see that there's muscle activity in the different 8 channels that we can capture. We summed the activity across the 8 channels and then divided it by the sum of the activity across the 8 channels when performing a maximum voluntary contraction. And that gave us a measurement of percent maximum voluntary contraction. We use the 90th percentile value, or the APDF 90, to represent the peak muscle activity, and then divide it by 10 to normalize it up to a 0 to 10 scale to get us this normalized peak force score. To quantify duty cycle and repetition rate, which was used to calculate a hand activity level scale, we took video. We collected about 10 minutes of video per worker, and we took a typical sample of 1 minute of that video and calculated the start and end of each hand exertion. And from there, we were able to, through the software multi-video task analysis, we were able to quantify the duration of time that someone was in a forceful hand exertion, as well as the frequency rate of those hand exertions. We also used MBTA to quantify the job-specific line speed, which, remember, would have been sort of at a couple of the jobs like chiller rehang and live hang, would have been the speed at which shackles passed a certain point per minute. And then we also used it to look at job-specific staffing and piece rate, meaning whichever worker we were analyzing, we also quantified each bird that that person handled or hung per period of time. Now, going back to our ACGIH TLV for hand activity, again, we use the frequency and the duty cycle from the MBTA analysis to calculate this hand activity level. That would be the 0 to 10 score down on the x-axis here. And then we use the EMG to calculate the amplitude probability distribution function, the APDF 90, and divide it by 10 to get a 0 to 10 normalized peak force score, which was represented on this y-axis here. To calculate the PFI-TLV score, you just use this equation, the NPF divided by 5.6 minus 0.56 times HAL. You can also just use this graph to see where the point would be, where the hand activity level and normalized peak force scores would join to see whether it's below the solid line or above it. We had teams of 7 people. We visited 11 establishments and were there for approximately 3 days at each establishment. Overall, we had 1,047 surveys, 508 medical interviews. We had video data on 480 workers, and we had EMG on 277 workers, and then used that information plus some demographic and other information to impute EMG data for the remaining number of people that we had video for, but needed a normalized peak force score for. I just want to preface this by saying we are not allowed to share photos, and this is not a photo of any of the participants in this project. This was taken from a news article from online. When we get into the results, our participants were on average 38.4 years of age. 42.2% were female, 36.6% were Hispanic. About half had English as their second language, and about half were born outside of the US. As far as job tenure, there were about a third who had been working at the establishment within a year. Roughly another third that had worked there more than a year, but less than 5 years, and roughly a little bit less than a third that had worked at the establishment for more than 5 years. Okay, when it comes to musculoskeletal symptoms, 40% of workers report experiencing moderate to severe work-related pain, so 5 or higher, over the past 12-month period. And among those reporting pain, 25% had difficulty maintaining their expected work pace. A third considered quitting or changing lines. A third reported having difficulty performing activities outside of work. 20% took paid or unpaid time off of work, and 40% did not report their pain to their supervisor or nurse. And I want to pause here just because obviously this describes a lot of people that were in pretty high pain. 5 out of a scale of 0 to 10 is 5 or higher is really a lot of pain. I think what is also really important to note is how many people did not report their pain to their supervisor or nurse. If you look at some of the injury logs, the OSHA 300 logs for this industry, we can see that injuries have been going down over time. We have to realize that when we look at those numbers, that there are a lot of people's pains that are not being reported, and if they're not being reported, they're not being counted as an injury on those logs. There also were quite a few people who were receiving first aid for a fairly long period of time and not necessarily ever going to medical. And again, if they don't get medical care and they're just receiving first aid, then they're not counted as an injury or on those OSHA 300 logs either. When we look at the PFI-TLV score distribution, meaning the measure of hazard, we see that 4 out of 5 workers had a PFI-TLV score greater than 1, indicating high ergonomic hazard. This is based on the 456 people that we had measurements for, and you can see that 80% had scores greater than 1. These 2 scatter plots represent the number of people, so each dot is a person, and then the dots, the different colored dots, indicate which ones have for example, the purple has were individuals at establishments where the line speed, evisceration line speed, was less than 145. The green dots represent a person who worked at an establishment where the line speed was greater than 145 but less than 175. And the open dots represent workers who worked at establishments that were operating at an evisceration line speed greater than 175 or at 175. And what you can see is that, again, the majority of people were above this red line. But there wasn't really a strong pattern that you could see by evisceration line speed. This is the same graph, but now that the different colors are differentiating the different piece rates. So if we were to take people performing different jobs and dividing them by their job work pace or piece rate pace into tertiles, we could tertile them into low, medium, and high groups. And we see a little bit of a difference where there's maybe some more purples here, but and more greens and open dots up above this line. But again, I think the main point is that the majority of dots are exceeding that threshold limit value of 1.0. So now this slide is looking at the associations between our two independent variables, line speed, evisceration line speed, and piece rate, and our outcome variable, which is the peak force index TLV score. And what you're seeing here is the mean score, the PFI TLV score. So in this instance, we had 167 people working at plants or establishments that operated at less than 145 birds per minute evisceration line speed. And their average PFI TLV score was 1.4 with a standard error of 0.2. If we compare the average PFI TLV score for the medium exposure category and the higher exposure category, we see that there's really not much difference. And you can see that here by looking at this column that shows the difference between say the mean PFI TLV score in the medium exposure group compared to the referent group or this lower evisceration line speed group. And you can see that the p-values are not statistically significant. This is different when we look at piece rate. Now remember, one of the important things about piece rate is that because every job has a different, essentially, speed of work, we categorized workers into low, medium, and high based on their job. And based on the number of items that they were handling and their job title, they were tertiled into low, medium, and high piece rate pace. And you can see that there is an increasing PFI TLV score with increasing piece rate. So those who had a low piece rate had an average PFI TLV score of 1.1, again, still over that 1.0 threshold limit value. And then those in the medium and high piece rate categories had 1.2 and 1.3 PFI TLV mean scores, respectively. And if you look at the difference between, say, the medium and the referent or the high exposure group and the referent, you can see that the difference increases as we increase in our exposure in piece rate. And both of these were statistically significant. So from this, we can determine that there was no difference in evisceration line speed, but there was a difference in hazard by piece rate. So live hang, as I mentioned, is taking live birds and hanging them upside down into these shackles. And I want to go over a couple of case studies just to identify really what was driving these differences in findings. We answered the first question that was asked, which was, is there a relationship between evisceration line speed and the ergonomic hazard? And there was not. But as I mentioned, when we visited these plants, we realized that there was a difference in really the pace of work of people in different jobs at different establishments. And the only way to really quantify that was to measure this piece rate. How many pieces were each people handling? We did see a difference in piece rate, meaning we saw an association between piece rate and increasing levels of piece rate and increasing levels of ergonomic hazard or PFI TLV score. And we wanted to know why. And so I'm going to explain two case studies, one in live hang and one in chiller rehang, to explain this. I didn't want to put a picture here because it's a bit of a sensitive topic, hanging live birds, but you have a drawing so you get an idea of what the workstation looks like. And when we look at these two relationships, the relationship between evisceration line speed and the PFI TLV score and piece rate in the PFI TLV score just among those doing live hang, we see a similar relationship between these variables and the outcome. So there's really, not very much difference at all between the average PFI TLV scores with increasing line speed, evisceration line speed, but we do see an increase in the PFI TLV scores with increasing piece rate, and that is statistically significant. So those that had a low piece rate in live hang had an average PFI TLV score of 0.9, whereas those with a high piece rate had a PFI TLV score of 1.8. And when we looked at the components of piece rate, really the components of piece rate is how fast is the line going at live hang, and how many staff are there doing that work. And so what we see, if we break up these statistics by evisceration line speed category, with this left column representing the slower line speed, and this category representing the highest evisceration line speed category, we see that the piece rate was actually highest among the establishments that were operating slower, meaning at that less than 145 birds per minute. And that was because we had this job-specific line speed of 148, and we had a lower number of staff of 6.1. And so that was one of the reasons we thought that this piece rate was a bit different and driving this increase in this PFI TLV score. So from this information, meaning the average PFI TLV scores and the job-specific line speed and the staffing that went into this piece rate score, we were able to put together a model of what the estimated piece rate would be for a certain level of staffing at a certain line speed for live hang. So this chart is specific to live hang, and it says, okay, if I'm a company that is operating my live hang line speed at 150 birds per minute, I need to have 7.5 roughly employees, meaning 8 staff, working that line in order to be at the TLV of 1 or less, meaning to have a PFI TLV score of 1 or less. And that essentially equates to a piece rate of 20.2. So if I were to go to and measure sort of how many pieces each person was handling, if they were handling 20.2 birds per minute or less, chances are they would be at this PFI TLV score of 1 or less as well. And so we thought this was a really nice way to give establishments a way to estimate what their ratio should be between job-specific line speed and staffing to keep ergonomic hazard at an acceptable level, meaning below this 1.0 threshold limit value. And if you're at a piece rate of 26.1 or a person is at a piece rate of 34.5, you're looking at PFI TLV scores of 1.5 or 2.0. And so this idea of incorporating a risk assessment tool into decisions around how many staff should be working given a certain line speed is something that we hope the establishments will utilize and incorporate to keep their workers safe. Okay, now in this example, the next example is going to be chiller rehang. So this is after the evisceration, after it goes into the cooler, and as it comes out on a conveyor. And these, again, this is not a photo that was from our exact study, but something that we got online. But you can see that they are picking up a whole bird and then hanging them onto these shackles by flipping their legs into these shackles one by one. Now, if we look at the associations between our independent and dependent variables, meaning the evisceration line speed and piece rate, and our dependent variable of PFI TLV score, we see a very similar relationship that we've already reviewed, where there's really no relationship with increasing PFI TLV score and increase in evisceration line speed. But we do see an increase in PFI TLV score with increasing piece rate. And that is, again, statistically significant, at least between the high and the low piece rate groups. And again, when we look at these three categories and we look at the job-specific line speed and the staffing levels and the overall piece rate, we see that the piece rate was highest in the establishments that were operating at a slower evisceration line speed. You can see that their jobs line speed, meaning the speed of the chiller rehang shackles, were quite fast. It was 113.1, which was faster than the establishments at these other two categories, meaning the ones in this medium and higher evisceration line speed categories. They did have a higher staff, but the combination, that the number of staff didn't wasn't enough essentially to account for this higher job-specific line speed. And so what we see is this piece rate of 30.7, which is higher than these other two groups. Now we did the same thing. We utilized the information on staffing and job-specific line speed in chiller rehang to identify what combinations of line speed and staffing would be needed to keep workers below this threshold limit value of 1. And so you can see the piece rate is 22.2. And again, if an establishment wanted to operate at 150, they would need roughly 7 workers to make sure that the workers stayed below this threshold limit value of 1. So in conclusion, what we found was that musculoskeletal disorder risk was not greater among workers at establishments with higher evisceration line speed compared to lower evisceration line speed. The MSD risk was greater among workers who worked at a higher piece rate pace, meaning this was, again, a job level measure of work pace compared to those who worked at lower piece rates. Regardless of evisceration line speed, we identified that 81% of workers across all the establishments were at increased risk of musculoskeletal disorder, and that 40% of workers had reported experiencing moderate to severe pain during the prior 12 months. This was really an incredible project. We actually looked at poultry processing workers as well as swine processing workers. We overall went to 17 establishments in 18 months and collected data for 3 days to 7 days at each of those establishments. We have a full report on the USDA website. This is the link for the full report for poultry processing line speed evaluation. The study has a lot more information than what I had time to go into, and it does have a lot of information on the methodology. We were really happy to see how well the wearable technology worked in this scenario. It really was a much easier and scalable way to collect electromyography data. And I would highly recommend it to others looking at evaluating risk for upper extremity disorders in the future. The MBTA was also something that is outlined in this report, meaning that the methodology used was outlined. And so if you're interested either in applying the methods or in seeing what some of the scores were when we incorporate it into, say, the revised strain index, you can take a look at this report. So what does this mean as far as waivers? And I think one of the more interesting and challenging parts of this project was how political it was. Again, this was a judge's order to have the USDA evaluate this and have researchers evaluate this question. And that was for both poultry as well as pork processing. As soon as the reports came out, there were all sorts of announcements and articles that often told half the story. Half the story meaning that evisceration line speed didn't have an effect or was not associated with increased hazard of upper extremity disorders. And I think that was unfortunate in the sense that the main point of the findings is that we really shouldn't be talking about evisceration line speed. There's no problem with plants operating at a higher line speed if they staff up properly and keep the piece rates at a reasonable level. But that's a big if, meaning as we saw with the establishments that were operating at, say, the 145 or less birds per minute, just because they're going slower doesn't mean they're doing so safely. And we found that there was a lot of increased hazard, ergonomic hazard, and risk for MSDs at those establishments that were operating more slowly. So I'm hoping that we can change the conversation from evisceration line speed, whether we're talking about pork or poultry, and really start talking more about individual workers' hazard levels. And, that is going to be impacted by how fast the work is coming at them on their particular line, as well as how many workers are next to them performing the same job and getting that work done. You might see that the FSIS was ordered to extend waivers to allow pork and poultry facilities to maintain higher line speeds. The rulemaking process, I believe, is still underway, and so there's nothing definitive at this point. I'm really hoping that this information helps change the conversation between labor and industry to talk about workload and individual workload instead of evisceration line speed. This is an example of one of the things that came out from the National Chicken Council. Independent study finds no correlation between poultry evisceration line speed and worker safety. Although they did say, while the industry has been safely increasing line speeds over the past 30 years, the poultry industry's injury and illness rate has fallen 89%. Yet we do show that 81% have high ergonomic hazard and 40% have been experiencing moderate to severe pain, with roughly a third that have had pain so bad that has impacted activities that they do outside of work, or even made them consider changing jobs or quitting. So we really shouldn't be ignoring this, particularly as labor shortages or our workforce become more slim and challenging to find workers. We really need to take care of them. One of the questions that we had asked was whether or not they had reported their pain, and remember that a really high percentage of them had not. And so clearly there's issues with really just interpreting risk and overall impact of the work from OSHA 300 logs and alone. More recently, articles have come out about workers talking about these fast-paced conditions. So the total disaster would be, establishments working faster through these line speed waivers and cutting back on labor. We were there for 3 days for poultry and up to 7 days with pork, and these numbers are based on the staffing levels that we saw. And if those staffing levels were lowered, then the number of people at risk would be even higher, and the amount of hazard that we would measure would be even higher. So our overall recommendations is, regardless of evisceration line speed, poultry processing plants really need to reduce their ergonomic exposures. Establishments could process chickens more chicken safely if they reduce the PFI TLV score to less than 1 by implementing sort of targeted job-specific piece rates and optimizing job-specific line speed with appropriate staffing levels. I also want to mention that we did not, it wasn't in the scope of the study to compare different knife sharpening best practices. There are a lot of well-established knife sharpening best practices which really have an influence or could have an impact on that normalized peak force, which could be a good way to reduce that PFI TLV score to less than 1. And I think that more work is needed to really understand knife sharpening best practices, training, replacement schedules, et cetera, and what their impact on ergonomic hazard is. We really found that we want to encourage early reporting of musculoskeletal symptoms and provide appropriate care beyond first aid. Again, we didn't have time to go into the medical interview findings or some of the things that we found with first aid. But I will say that we did see quite a few workers or hear quite a few workers complaining that they were given first aid for a very long time. So ice, Advil, maybe some tape, and that they, every time they mentioned that they had some pain, they would be given some first aid and never really allowed to see the doctor or informed that they could see a doctor. And what happens over time is not only does that incident get or that pain develop into an injury, but it also means that people aren't going to report their pain and symptoms anymore. Because if they really want to go to a doctor and they're just getting first aid that doesn't seem to help anyway and is something that they could just do at home, then they might lose confidence that they could actually see a medical provider, and so they just stop actually, letting people know that they're in any pain until the pain gets to a point where they actually can't work. So, from what we saw, the poultry industry really could review the long established best practices that have been in writing since 1993. We saw some of them being incorporated and some of them really not being incorporated at all, or at least not consistently. We think that the poultry processing industry would really benefit from some sort of multi-stakeholder consortium approach, maybe similar to the auto manufacturing industry like US Car. That way they could look at some of these issues and questions and answer them collectively and share some of their best practices. And I think they would get a lot further together than, separate. I want to thank the USDA for their support of this project. I particularly want to thank the workers and the companies and the labor organizations for their cooperation and support of the study. As I mentioned, it was a whirlwind of 7 people going into a site at once for anywhere between 3 and 7 days, and it was a lot for everyone, and we really appreciate people's participation. I also want to acknowledge NIOSH. Their training grant really allows our center and our Education Research Center and our Human Factors and Ergonomics program to exist. Certainly they supported a lot of training of students that participated in this project. There were close to 100 students, faculty, and staff who collectively contributed thousands of hours collaborating on this project, and I want to give them a huge shout out and a huge thank you. There's information on our website if you're interested in this research project or others. And I want to say that this project was really hard, and it also was really fun. It was a fantastic way to teach students about, field work. They did a fantastic job in the field and really learned a lot. And a lot of them found a new career path. And so projects like this are really excellent for getting people interested and engaged with occupational health. I would be remiss if I didn't mention NIOSH. I hope you've heard that NIOSH has essentially been eliminated by DOGE. And so I want to bring your attention to the Pound Save NIOSH movement, which just talks about all the different, things that NIOSH has done for so many centers across the country. And it's really up to us to help inform people how important NIOSH is and how much they do and get it reinstated. If you go to this website at coeh.berkeley.edu, you can read about some of the different research projects that our students and faculty have engaged in. We've been working hard to put our impact stories up on the web so that people can understand what we're studying and how it impacts either you or people you love or people that help make your day better, whether it's through restaurant service or janitorial service or construction, etc. So take a look at our website to read about different impact stories. NIOSH has 38 extramurally funded um, education research centers, agricultural centers, total worker health centers. All of these centers are at risk. This webinar series is supported by this training grant, our education research training grant, and those grants at the other 17 ERCs. And so if you like this series, it's a good reason to get involved. NIOSH also has a lot of intramural programs that we all depend on, everything from productive aging and work, center worker for fatigue, robotics, AI, respiratory protection, mining research, you name it. And so if you are interested in helping, please visit either our website for 4 different ideas and ways that you can help NIOSH. Reach out to your legislators. They are counting the calls and they're counting the emails, and your voice has power. So please visit some of these sites for more information on how you can help. Thank you.
Thank you so much, Dr. Harris. Really appreciate your research, your time, coordinating those hundreds of people, getting all of the data collected, and also again, just a shout out to NIOSH, and then that again this webinar series would not be possible without NIOSH. So just want to acknowledge the support that is provided through that. At this time, we do have time for questions. So if you have a question, please go ahead and enter it into the Q&A. We do have a couple of questions in so far. First, were any of the plant teams inspected unions? And if so, did the results vary depending on whether they were represented by a union or not?
Yeah, it's a great question. We have not done that analysis yet. Unfortunately, our contract was one of those that got cut short. But so we haven't actually looked at differences in associations by union status. There were some establishments that were unionized and some that weren't. So we could look at that in the future.
Thank you so much. Another question, are you aware of what % of the workers were H-2A contracted? And I think that is oh, go ahead.
Oh, you mean basically independent contractors? Is that what they're, or, well,
I think it's
yeah,
H-2A contracts are work agreements between U.S. employers and foreign workers for temporary seasonal agricultural labor.
yeah, we don't have a number for that, but I can tell you anecdotally that there certainly were a lot. Different plants had different strategies for meeting their workforce needs. And there were certainly some plants where, we had a translation service, and some of those plants, we were on the translation service line a lot because we had people from Haiti and people just from all sorts of places around the earth. So I think that there were probably a lot of those, although we didn't ask specifically what their visa status was, just because we thought that was kind of a sensitive topic.
Thank you so much. Did you notice if there was any correlation between job tenure and pain?
That is a great question. And actually, I wish I could remember the results right off the top of my head, but one of our medical residents who did attend these trips is actually presenting on that at ACOM this week. And I don't think it was statistically significant. But anyway, I'm sure she'll be writing up a paper about that sometime soon.
Thank you. Thank you. Beyond your focus on musculoskeletal injuries, what other injuries were observed?
Well, I know that Jenny's going to be talking about respiratory symptoms from PAA. As far as other types of injuries, we did ask whether there were any sort of safety hazards. And, I don't have a number off the top of my head, but, broadly, it seemed like establishments were doing a much better job of preventing safety issues and hazards than ergonomic ones. But we didn't collect specific information to be able to tabulate any kind of specific hazards like due to cuts or lacerations or something.
Thank you so much. Other than hand actions, repetitions and angles, did you capture or include the work of locations and posture on the upper extremity and its effect on force production?
So we did have electrogoniometers on the wrist to calculate acceleration, velocity, and posture at the wrist. Those were not used in the TLV for hand activity, but in the report you can look at some of those numbers, and we did use it for the revised strain index. Um, we didn't look at the shoulder because there really isn't a well-validated risk assessment tool for the shoulder. So we do have video that where hopefully in the future some future student can look at the shoulder position from the video. And we could, look at some of the like use the shoulder tool or some other tools to be able to evaluate risk to the shoulder. Um, but we did try on some in the swine study, we did actually put an IMU on the arm for some workers, but it was a little bit less consistent of data, so we didn't put that in the main report. So anyway, hopefully that's coming.
Thank you. Got a couple more questions here. We're going to try to get through as many as we can before the webinar concludes today. Was there a difference in the plant's attitude towards occupational injury and the size of the plant?
I'm sorry, say that one more time.
Yeah, did you notice any difference in the plant's attitude towards occupational injury and how big the plant or small the plant was, the size of the plant?
No, I don't think it was based on plant size, but I do think company establishment and their culture had a huge impact. I'm not sure. Yeah, I can't really say much more, but there was certainly a difference. And we tried to go to one. We had six different companies, and we tried to go to one establishment that was, we're operating more slowly, and one establishment that was operating at a visceration line speed that was faster. And certainly across those six establishments, there were some differences.
Thank you. And can you explain the rationale behind the study focusing on reporting on line speed and piece rate instead of evaluating repetition frequency exposures resulting from the combination of increased line speed, staffing levels, and process organization?
Yeah, I mean, the problem with looking just at repetition rate and say duty cycle and force is that you're looking at one exposure at a time. Obviously, we can do that. We can look at the relationship between repetition rate or duty cycle or percent time and forceful exertion and the outcome. And maybe in the future we will, but to really be able to get a good understanding of how those exposures come together to increase risk, we need to use one of these risk assessment tools. And so that's why we presented it this way. It's not to say that those exposures aren't important or interesting, but the document was, I think, 150 pages as is, just using, presenting the risk assessment tools as outcome measures. And so I think that is really the most appropriate way to look at overall hazard due to multiple ergonomic biomechanical exposures.
Thank you so much. We only have time for one more question today, but don't worry, we're going to have more Pulse research coming to you in another webinar again soon. But I'd just like to close with how accepting was the workforce in being connected to the sensors to monitor them? How did the workers react to that?
They were amazing. I mean, these workers, I think some of these workers and the interactions that they had with our students are why so many of them that weren't current students, but were between like our undergrads or just graduated from undergrads are coming back to get an MPH in this field. They were gracious. They were open. We had a very low rate of refusal for participation. Obviously, this went through the IRB and we got consent from folks. And I think I can't remember the exact number, but I think it was in the 90s. I mean, really most people that were asked chose to participate. So we're very grateful to them.
Well, thank you so much again, Dr. Harris, for sharing this important research and spearheading this project. Again, for everyone else on the call, thank you for being here. Thank you for showing your support for workers. We are going to have another webinar specifically on the PULSE study. So be sure to check out our website for more information at coeh.berkeley.edu. And I hope you all have a wonderful rest of your day.
Thanks, Michelle, and thank you everyone for coming.